As of this week, more than half of the state's nursing homes have at least one confirmed case of COVID-19. That's why a lawmaker from Texas is pushing for a closer look at why the virus is still spreading in these homes and what more can be done. Investigator Avery Travis has a closer look at the ideas discussed by a U.S. House subcommittee examining the crisis.
My brother should still be alive.
A few weeks ago, we met Delia Satterwhite, the sister of an Austin nursing home resident who died of COVID-19. Now she's sharing her family's story with U.S. lawmakers.
It felt like they were keeping a secret. No one wanted me to know what was happening.
Government data shows there are more than 800 nursing homes that still have not reported the required information to the feds. And more than 100 of those homes are in Texas, more than any other state.
We don't have the information we need to make good policy or to protect families.
Lack of transparency wasn't the only concern at Thursday's hearing.
We have seen for 30 years now the standard of sufficient nurse staffing, and it's not enough. And what we see a lot is that nurse aides have not just 15 people, but 20, 25 residents that they're responsible for.
Analysis of the federal data reveals staff shortages are even increasing each week.
There were many days I came home crying. Today we are still understaffed, overworked, and still do not have enough PPE.
Experts called for pay increases, better benefits, plus more robust training and recruiting efforts to fill the staffing gaps. Meanwhile, lawmakers called on the federal agency collecting this data to step it up.
Give us what you've done about these report cards, or else every one of you should be fired from the top to the bottom. I've had relatives that have been killed in these nursing homes, and I'm not going to leave this alone.
For State of Texas, Avery Travis.
Thanks, Avery. In Texas, long-term care facilities are bearing the brunt of the coronavirus burden. Those facilities account for 45% of all the COVID-19 deaths statewide. Tom Miller talked with the Texas branch of the American Association of Retired Persons, AARP, on what needs to be done to protect our most vulnerable seniors.
What do you feel like needs to be done to make sure that there aren't more deaths?
There needs to be national attention and national action to make sure that the facilities have the supply of PPE that they need, that there's a regular plan and regular testing of staff and residents, particularly as there's talk of facilities potentially allowing visitors back in.
Where do y'all stand on that potential plan for visitors to be allowed back to visit with loved ones?
We want residents and family members to be reunited in person. At the same time, the virus is very active. Numbers are spiking in Texas, and this population is at serious risks.
Do you think it's possible to do that safely, or do you have serious concerns about that?
We think it's possible to do it safely, but that includes having a plan for regular testing, particularly for staff, but also for residents.
What does the AARP think about granting immunity to these nursing homes for the deaths that are happening under their watch?
Congress and the state should not let nursing homes off the hook for abuse, neglect, or death.
AARP Texas is also lobbying for the city, state, and federal government to make public which nursing homes have had positive cases. Mandatory quarantines for travelers from Texas. How our spike in cases could put restrictions on your travel plans.
It's the same thing as anything else in healthcare, Aaron. They charge what they want to because they can.
Don't overpay for your COVID-19 test. Our investigation goes over what you need to know beforehand to avoid a surprise medical bill.